Hi, my name is Chloe Weddington. This is my visual for bipolar disorder. I feel it represents bipolar disorder because on the left side, it can represent having dark thoughts at one point while having happy thoughts at the same time. I'm going to share with you some facts on bipolar disorder. Bipolar is a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Bipolar is common and easy to diagnose if you understand and are educated to know the symptoms. There are many signs to watch for, so be sure to pay attention and listen closely. Many people go through traumatic experiences or depressive episodes, often turning to alcohol or drugs to cope. When you are younger, developing a substance abuse can only lead to worsened depression and moodiness, a major player in some cases of bipolar disorder. Bipolar has also been proven to be genetic. Normal imbalances might also trigger or cause bipolar disorder. Each case requires a medical diagnosis. Bipolar disorder cannot yet be diagnosed psychologically by blood tests or brain scans. Currently, diagnosis is based on symptoms, course of illness, and family history. When you have been diagnosed with bipolar disorder, the first step is accepting this, which may take time. Once you understand that this is a part of your life that you will be managing and not something that defines you, it will be easier. It is recommended to practice mindfulness, maintaining a non-judgmental state of awareness of your thoughts, emotions, or experiences, moment by moment. Talking to your healthcare provider can help you to understand your bipolar disorder better. The symptoms of bipolar vary. One person may have more depressive symptoms while another has mainly manic episodes. When experiencing a manic episode, a patient has high energy levels with reduced need for sleep. There are lots of symptoms to look for in bipolar. Behavioral symptoms include risky behavior, aggression, excess desire for sex, hyperactivity, and self-harm. Mood symptoms include sadness, anxiety, general discontent, guilt, and hopelessness. Lastly, cognitive symptoms include unwanted thoughts, delusion, slowness in activity, and racing thoughts. In the United States, there are 3 million cases per year. Bipolar disorder cannot be cured, but treatments and medicines may help. Mood stabilizing medicines are usually the first choice in medication. Lithium is the most commonly prescribed mood stabilizer. Bipolar is much better controlled when treatment is continuous. In addition to medication, it is strongly recommended to go to counseling for you and your family. If left untreated, bipolar tends to worsen and the person experiences episodes of full-fledged mania and clinical depression. Bipolar disorder can last for years or be lifelong. The usual onset is late teens to early 20s. Home treatment is important in bipolar disorder. There are many things you can do to help your mood swings. One of the easiest is keeping your diet healthy. Once you get this routine down, it will be easier to add other home treatments to your daily life. Make sure you are getting enough exercise. 30 minutes a day is recommended. Even just going for a walk will help to keep your mood swings under better control. If at all possible, make sure you are getting enough sleep. During manic episodes, this can seem impossible due to the increase in your energy. However, going to bed at the same time every night and keeping your room dark and quiet can help tremendously. Bipolar disorder is most commonly confused with depression. When you have bipolar disorder and the depression that comes with it, you may find that certain situations or events can lead to an episode of depression or change in mood. The main difference is the presence of manic episodes. Depression alone is not enough to diagnose an individual with bipolar. However, the presence of one manic episode is sufficient to make a bipolar diagnosis. For an episode of mania to be diagnosed, it needs to last for at least a week, or shorter if the patient is hospitalized and treated. This illness can cause behavior so extreme that you cannot function at work, in family or social situations, or in relationships with others. Some people with bipolar disorder become suicidal. It is important to know you are not alone. Talking with others who suffer from bipolar disorder may help you to learn that there is hope for you in life.